Okay, well, we're going to go ahead and get started. Thank you so much for joining us this evening at the DNP Informational Session. And we are just really glad to have all of you guys here in Oklahoma City and in Tulsa. We are recording tonight, so if you have a question, we'll ask you to push your microphone that's located in front of you and hold it while you speak, but I'll also rephrase the question so that everyone can hear it. And
It's not you.
okay. Anyway, I'm Amy Costner-Lark. I'm the director of the DNP program and also the director of the F&P pathway. So it's one big DNP program with 3 different pathways. So I'll let the other 2 directors introduce themselves as well.
Does this work? Okay, great. I'm Susan Dresser, and I'm the director of the Clinical Nurse Specialist program.
I'm Pam Crawford, and I'm the program director of the Executive Nurse Leader program.
So the DNP program at OU College of Nursing has been around since about 2011, and what we're doing now is we're just creating a new entry pathway into the program. So you can still enter with your Master of Science degree in nursing, but now you can also enter with a BSN in nursing. So we just have opened up doors to try to invite more applicants into the program for several reasons, partly because of credentialing is moving towards a doctoral degree for entry into practice by 2025, but we also know that the healthcare system is very complex and changing very, very quickly. So having nurses educated at the highest level possible, or a terminal degree or a doctoral degree, we feel is very pertinent. So we just wanted to make sure that we remain competitive not only in the state but also nationally. And just to remind everyone that the DNP degree is not a new degree. It's been around for about 20 years, and that it's been here at OU College of Nursing since about 2011. I got ahead of myself. Our graduates have a very rich history of publications. In fact, we just got notice from one of our graduates today that her DNP project was featured on the cover of a very nice research journal. So that was really cool to see her hard work not only published, but it was the cover story for the article. So that was awesome. The career advancement is one of the things we're the most proud about, is because most of our graduates do go on to a higher level in their career after they do achieve their DNP. So it's important, and it helps nursing to really be at the table with all the other professions. We do feature our DNP projects on the website that you can look at for the past 3 years and kind of get an idea of what a DNP project looks like. They are quality improvement projects. They are not research projects. So we're going to talk a little bit about the PhD versus a DNP. So a PhD is a research-focused doctorate, and in fact, some of the faculty members have PhD, like Susan and Dr. Kraft, whereas others of us have a DNP, myself and Pam and other faculty members. So you have both on the faculty that are teaching in the DNP program, which only increases the knowledge and just the variety of your learning styles. So unlike the PhD, the DNP is a clinical practice-focused doctorate, and both of them are terminal degrees in nursing, and but one difference is that the PhD prepares nurse scientists or for research, whereas the DNP is preparing advanced practice nurses and executive leaders. So in the PhD program, you do research and you do a thesis, whereas in the DNP program, you're doing a quality improvement project for your final project. Within our BSN to DNP program, we have 3 pathways. We have the Family Nurse Practitioner pathway, the Adult Geriatric Clinical Nurse Specialist pathway, and the Executive Leadership pathway. All the students, regardless of their pathway, will take a similar group of core courses, as well as all of the DNP pathway courses are the same, regardless of pathway. So where the differences come is when you do get into your pathway, there's differences in the Family Nurse Practitioner and the CNS, and some things they take together too. But because Family Nurse Practitioner goes across the lifespan, we do have some pediatric courses, whereas in the Adult Geriatric program, it's all adult and geriatric focused. Also, the clinical rotations are slightly different within those two pathways. All 3 have part-time and full-time programs available. The full-time program for all 3 pathways is 3 years. And then we also have a 4-year pathway and a 5-year pathway for the part-time. So you can choose your speed as, how quickly do you want to complete this. The Family Nurse Practitioner and the CNS are both hybrid programs with some on-campus and some online components. Whereas the Executive Leadership Pathway is 100% online, and you can live in Texas or Wyoming or Maine or wherever you want to live. Whereas with FNP and CNS, you do have to have an Oklahoma RN license and be on campus a fair amount. I would say it's probably about 85% online and 15% on campus for the two, adult and family. So what we did on cost, it's roughly $50,000. That's calculated based upon a full-time student in the 3-year pathway, regardless of which one you go into. So the way we figured it is the credit hours are, you take the number of credit hours times the tuition, which is 505 right now, and then you have to add in the fees. So if you chose to do a 4 or 5-year option, it would be more than $50,000 because you'd have more fees, but not, $100,000 or something. So you can figure it out, but that's kind of the general idea on cost. If you guys have questions in here, just yell or raise your hand or wave me down. We can answer as we go along. Here's a breakdown of, except this is different now. Yeah. Okay. So the Family Nurse Practitioner, 72 credit hours and 1,040 clinical practicum hours. The CNS is adjusted. We adjusted this afternoon. We found an error. So it's 68 credit hours and 1,050 clinical hours. 68 credit hours and 1,050 clinical hours in the CNS program. So that slide's incorrect. And the executive leadership is right at 70 credit hours and 1,088 clinical practicum hours. We're going to go through the difference between hours, how they're broken down just a little bit later. In order to graduate with your DNP, you have to have a minimum of 1,000 clinical practicum hours. So we can see we're right at the mark. Admission requirements, a bachelor's or a master's degree in nursing from an accredited institution and an unencumbered registered nurse license in Oklahoma if you're applying to the NP or CNS program, and an unencumbered license in any state of residence for executive leadership applicants since it is 100% online. You do have to have an undergrad statistics and research methods course and a 3.0 cumulative GPA. I was going to mention here on the last session that we did, one of the students or the applicants asked if her statistics and research methods were 25 years ago, did she need to retake them? And it's not really necessary. I mean, you just have to have completed them. But she was thinking about retaking them just for the knowledge part because she hadn't had them in so long that she might need that. So it's just something we could talk to you on an individual basis if it's been a while since you've been in school.
I would just say that our statistics professor, in-house statistics professor, she's wonderful. She would actually probably say don't.
Okay.
Retake the statistics course.
Okay.
Because she actually prefers people just come in de novo. I mean, take what you had, but then she's going to make sure that you get what you need. So.
Good. Okay, in case you couldn't hear that in Tulsa or Lawton, she said that the statistics professor here that teaches that course would prefer you don't repeat a statistics course, which is great. Saves you time, money, and she's going to teach you what you need to know for your DNP program. So good news. Applying to the DNP program, it really hasn't changed. So what you'll do is it's available on Nursing CAS, which is the online application for nursing colleges where you have to upload your transcripts and your resume or CV. And then we also have some essay prompts that we ask you to answer. Those questions are actually listed on our website, so you can get those questions and start working on your essay if you want to at this point. And then there's a supplemental application for the College of Nursing, which just asks some more demographic type questions. And then you need 3 professional references, either from somebody you work with or maybe a previous professor. Those are the requirements.
Can you press your button down?
Okay, let's hold it down. Let's see if it works. Okay. Can Can you hear me? Good.
Mm-hmm.
You can? Okay. If you have a nursing cast account as from before, is it always open for your reviews? Would I have to go in and redo a whole application and upload the same transcripts and, for previous application?
I don't. Okay, her question was if she had a previous account with NursingCast, would she have to go in and recreate it, or would she be able to log into her old account and just go from there? And the answer is, I don't know. Does anybody else know?
No, I don't know either, but it's a great question, and I think it's similar to what you asked, and we can certainly find out and let you know.
Yeah.
I don't know how long NursingCast keeps records, but good question.
It is. Because I'm sure there are. Yes, it is. So DNP preparation falls into two advanced practice roles, those that are the advanced practice nurse, such as a nurse practitioner, a clinical nurse specialist, certified nurse midwife, and a certified registered nurse anesthetist. And then there's also the executive leadership role, which specializes more in aggregate or systems approach at the organizational level and more of a nurse leader role. But they're all considered to be advanced practice nurses. So you just want to make the distinction. Okay, yeah, go ahead. We still can't hear you, unfortunately.
I think she's talking.
Oh, okay. Oh, she's probably talking to IT. Okay. Okay. Many benefits to becoming an advanced practice nurse: autonomy, increased flexibility at the workplace, different jobs are opened up for you, obviously increased earning potential, advanced practice skills, and more independent practice are all benefits of the advanced practice degree. So like I said, there's the four direct care advanced practice nurses that I already mentioned, they all complete a advanced practice education program and have passed their national certification in a recognized population. So we're going to talk a little bit about the consensus model, yes, in just a minute, which kind of talks about populations that you would be practicing with. And all the advanced practice nurses are licensed by the Oklahoma Board of Nursing in their advanced practice role, and that's who their prescriptive authority comes from. But then they're board certified on a national level by a certifying body, such as American Academy of Nurse Practitioners, or what's the CNS one? National Association of Clinical Nurse Specialists. So with the advanced practice degree, we're building upon your RN competencies and your experience that you bring to the table as an as a registered nurse that you've been practicing, and then work to increase those skills in your knowledge level. Pam? I'm going to let Pam talk a lot about the executive nurse leader.
Okay. Excuse me, allergies have gotten me. So, as far as what is an executive nurse, I imagine most of you know that. But you're really practicing administration at the executive leadership role. You're promoting innovative approaches in complex healthcare organizations. You're utilizing the technologies to enhance efficiency, and you're overseeing patient safety and quality. Basically, the areas below really are taking a look at the essentials and what the essentials say, as far as the program goes, what the outcomes will give you. And, you're going to be working with interdisciplinary teams a lot, and that is something that is not done very well, I would say, right now in the healthcare organizations. Everybody has been educated in the silo, and it takes a lot of skill and communication and expertise to get people to work as a team. So the nurse executive really has a lot of those skills and can bring that team together. You're going to do a lot of strategic planning, which hopefully, if you like planning, you can really take the lead here as well. Usually your chief executive officer is in charge of that, but you're going to give major input into that in terms of how you're going to implement patient care across the organization. You're going to certainly measure your outcomes, your patient outcomes, organizational outcomes through quality. You're going to be using a lot of information management skills in your decision making. We've already talked about quality improvement. You can also do policy development at the local, regional, and international level, and continue on with research and protocol, best practice protocols. If you are an individual that likes to have major impact on the decisions in the organization, if you want to try and better the nurse practice within the organization as well as healthcare practice, I would highly suggest you take a look at this area. You can have a major impact in the organization. So I think you're very well needed, very much needed, more so than some of the others think you're needed, but once they get into talking with you and what you can bring to the table, and you always want to be at the table, you'll have a major impact to your patients and your organization, as well as the nursing staff and the professional development of nursing staff and how they can participate. I was the chief nursing officer at OU Medical Center for about 18 years, and I came over here about 11 years ago. So I've really enjoyed teaching this, because I think as a nurse executive, sometimes we hold back, and you really can't do that in the organization. You have to take one of the leadership roles and really promote nursing, what nursing could add. So think about it.
Okay, so the question in Tulsa was, do we require the applicants to shadow or follow an advanced practice nurse or someone with a terminal degree before you can apply? And the answer is no, we don't require it. But it might not be a good or a bad idea to do it if you have the opportunity, just to make sure that you know exactly what you're getting into and that the role is exactly what you want to do. But it's not required. But I know on some of the applications in the past that I've read, people would talk about their opportunity to shadow somebody, and it did help to seal their mind that that's what they wanted to do, or perhaps they changed their mind after they had shadowed somebody. So it's optional.
And could you tell them that it's also not required for the PhD program?
Oh, yeah, she asked about the PhD program. It is also not required. It's not required by any of the programs. So. Okay, so the next couple slides, we just have a little bit of a breakdown between the three pathways, basically where they provide care or where they're working. So the executive leadership, as Pam mentioned, is more of an administrative healthcare policy, population-based, organizational and systems management, whereas the family nurse practitioner is primary care focused across the lifespan. So you can see anyone from birth to death in a primary care setting, which is outpatient primary care, like a family practice or an internal medicine, a pediatrics. You can also go into specialty care in an outpatient setting. And then the adult gerontology CNS is wellness to acute care in adults and geriatrics. Jump in if you want. Okay. All right, so the DNP courses, like I said earlier, are all the same regardless of pathway. The clinical science core, these don't apply to the executive leadership. This is what we call the 3 Ps. The 3 Ps are pathology, pharmacology, and physical assessment. So the CNS and the NP students take those 3 classes together. And you would take those regardless if you were in an FNP, a CNS, or if you were in some other advanced practice like midwife or CRNA, but we don't offer those 2 here at OU. Then you come to what's called the pathway courses, and this is where they are different. You'll see them on the degree plans that we've passed out. They'll also be available online, where it just shows you the specific classes to that pathway. The role, we kind of already talked about that. Point of entry is BSN or MSN for all 3. I know, I saw that. And we already talked about credit hours. also talked about the number of clinical practicum hours, and they all can be taken in a 3, 4, or 5-year option. Any questions about that? No? Okay. The
You might explain that practicum thing. What's the difference in clinical?
Oh, okay. So you'll hear us sometimes saying clinical hours, and you'll also hear us saying practicum hours. So the difference in clinical versus practicum hours, in the NP and CNS pathways, you have hours, approximately 700 hours to do with a preceptor in a clinic where you're seeing patients with a preceptor or in the hospital setting, depending on where you're at, and you're seeing patients with him or her. Practicum hours are the hours that you're working on your final DNP project, which is a quality improvement project. You can do those at a facility where you currently work as an RN, or you can do those at a facility where you're doing some of your clinical rotations. Perhaps you're doing a clinical rotation at Mercy Primary Care on I-35, and you really see a process that isn't as smooth as it should be, and you propose that you do this quality improvement project to maybe help their clinic run smoother or something, whatever it is. You're looking for things that could be improved or how we could use more evidence to provide evidence-based care in a clinical setting. So you're interpreting evidence and applying it in a quality improvement project, and it can be at your workplace or at a clinical site. So the practicum hours are for the DNP project. There are approximately 300 to 400 of those hours. They are not the same as clinical hours because when you're doing the DNP project, you're not actually seeing patients. You're working on a project. Okay. Questions about that? How we differentiate those? Yeah.
How do you keep track?
Okay.
Of the actual project?
Okay, so the way that you keep track of all the hours, whether they're clinical hours or practicum hours, we use a software called Typhon. You might have used it at an undergrad or if somebody has used it before. But anyway, it's just a logging system where you log how many hours you did and what you're actually doing, whether it's patient care, doing research for your project, working on data collection, something like that. So yeah, it's all tracked in a software program. Good question. The Typhon is really good, especially if you're doing one of the NP or CNS roles, because you can actually track the number of patients. You can get really, really specific with Typhon. And when you get done, print out this sheet that shows how many patients with heart disease that you saw, or how many patients with hypertension, how many African-American patients you saw. It's really, really cool. You can get really detailed, and then that way when you go to apply for jobs, say you did want to work in a specialty type practice, you can show, okay, I have this much experience and with this patient population because you've tracked it all in Typhon. So the courses in the Executive Leadership Program are 100% online. And then some of the courses in the NP and CNS are also online. So you'll see that all of the DNP component is all online. You will be doing writing and presentations and doing papers. The 3 Ps, which are those science cores that the CNS and NP students are taking, those are hybrid. The advanced assessment class, you have a weekly on-campus time where you come into class and we do practice exams. Pathology is online except for testing, and then pharmacology is the same way. So you just come to class about once every 6 weeks or so for tests for those 2 classes. He also, in pathology, he offers an in-class lecture, but it's recorded, so you can watch it at home if you don't want to come, or if you choose to come sometimes and don't the others, that's fine too. So they're hybrid. And then executive leadership, 100% online. Okay, so now what we're going to do is kind of break into APRN information, so this is specific to CNS and NP, just to kind of differentiate the two a little bit and to make sure that you are applying to the one that fits your interests. Susan is going to talk about the consensus model for us, and there you go.
Hello, can you hear me?
Okay, great. So I'm going to try and talk a little bit about this model. It looks kind of confusing and complicated. I wish I could just sort of scroll it, but starting at the bottom, sometimes the hardest decision that you need, I would say the most important decision that you need to make when you're entering our DNP program, or if you're entering any DNP program that offers APRN roles, is which of these roles really resonates with you? Which type of practice do you see yourself doing? So it's very, very important. Now, somebody asked the question about shadowing. So that's just something that if I were really indecisive and I'd never worked with a CRNA or I'd never seen what a midwife did, I would probably want to do that. It's not something we go out and tell people to do, but if I was sitting on the fence, I might want to shadow a couple of these people. But because it's very important that you understand what the role does, what the opportunities are. So that's your first decision point. Well, do you want to go to our program? And then if you go to our program, do you want to do one of the APRN roles or the executive nurse leader role? So you would choose first, if you're doing an APRN role, between the two programs we offer, which are, of course, the family nurse practitioner or the adult gerontology CNS. So you would choose. There's going to be a dividing point between you and some of your classmates. So the consensus model is really what we call our regulatory Bible, if you will. It was developed over about a 5-year period. I feel like I'm standing and you can't see me. And it was developed by multiple nursing organizations. Multiple people had their hands on this. And after maybe a 3, 4, 5-year period, it came out in 2008. It's the first attempt that we've ever had to standardize the education, the certification, the licensure, and what did I leave out? Accreditation of the universities that develop these programs. So the goal was to minimize a lot of the variation that existed from one program to another and from one person who's practicing as a certain type of role from one state to another. There was tremendous variation across the country. And you might say, well, what's wrong with that? That is a patient safety risk. So the goal was to improve patient safety. That's the end goal through education, certification, licensure, and accreditation being standardized. So with that being said, these four roles are the only APRN roles that are recognized across the country. Even though we have a lot of different titles, and you may work in facilities where you have titles I've never heard of, but they are not advanced practice nurse titles. So once you decide on which role interests you, then you choose a program that offers that role in one of those populations. So let's just say you were very, very interested in being a clinical nurse specialist, but you wanted to be a neonatal clinical nurse specialist. There are programs like that out there, but we don't offer that. So whether you go to Vanderbilt or Duke or anywhere in the whole country, nobody offers all programs, so you have to choose which one matches what you want to do. So you could be a clinical nurse specialist if you went to our program, but you would not focus on anything other than adult gerontology. Same thing if you wanted to be a psychiatric nurse practitioner, there are programs for that. We don't offer that. So we have the two that we offer. Somebody else, Joe Schmo across town, may offer something different. You choose Joe Schmo University. So you have to make that decision. So you don't go to a program and hope that it morphs, and you can't make it fit what you want. You're going to end up with what that program prepares you to be. So think about that going in. If you love pediatrics, the adult gero CNS program is not for you, because you will never, ever, ever lay your hands on a child. So you choose your role, you choose your population, and then within the population, you can still specialize, whether it's with the CNS or the NP. So you're being prepared at a population level, but let's just say that your heart is really in oncology, and you're sitting there right now being crushed because you don't see oncology as one of the population. Any oncology people out there? I know you are. Well, fear not. You can still specialize. You just have to first meet that big umbrella of one of the populations of adult gero, pediatrics, whatever. And then within that pediatric population, you could do pediatric oncology. Does that make sense? So you can still do what you love, you just have to stay within your population. So these are the things that cause confusion among people in the practice world right now, and you may hear some things about it, but if you have questions particular to our program, then either Dr. Costner-Larkin or I could answer those specifics.
Okay, so there are a lot of similarities between the nurse practitioner and CNS program here, but across the nation, they're all going to take the 3 Ps, the pathology, the physical assessment, and the pharmacology. They're all going to take the same DNP courses. They're all going to have over 1,000 hours of precepted time, and all graduate with prescriptive authority eligibility. But the difference is what kind of patients that they're going to be providing care to in the end. So the takeaway point is that FNPs are prepared to practice in the outpatient setting. We don't want applicants to come to the FNP program and then want to practice in the ICU, because it's happened for many, many years, and you see FNPs practicing in inpatient ICUs and doing rounds on just a med-surg floor all the time. Unfortunately, that's really not their scope of practice. I've done it too. It wasn't my scope of practice, but the Board of Nursing and the payers like Blue Cross Blue Shield and other payers are starting to take notice of this, and they're really emphasizing that we need to practice what we were prepared for, and FNPs are prepared for outpatient practice. It can be a specialty, like I work in adult neurology in an outpatient clinic, but it can't be in the hospital setting, okay? So if you hear nothing else, just make sure you understand that, because we don't want someone to come with the wrong expectations because of what they've seen in practice over the years. We have many graduates working out as advanced practice nurses, but we also have many in the executive leadership at the big hospital systems across Oklahoma, and we have some at VA. We also have one over at Integris that's in charge of all of the research. That she is actually kind of thinking about coming back for a PhD now too, because she really is loving the research aspect, but the DNP is what got her into that job. And so we just have so many stories. Susan George. I'm a mom, I can hear. So the DNP has really advanced a lot of the graduates' careers, and we want it to do the same for you. So the family nurse practitioner roles, like I said, they can work in physician outpatient offices or group practices, doing primary care like family practice or internal medicine or pediatrics. They can also work in governmental agencies like the health department. You'll see them working in prisons, Indian Health Center, and also at like Tinker or any other military base around. They do a lot of the urgent care. In fact, like CVS is exclusively run by nurse practitioners, or they have used some CNSs as well. And then any kind of outpatient specialty that you want to practice in across the age of birth to death, you can. So it's not limited to just primary care, but it is limited to an outpatient setting. So people say, well, what if one of my patients gets admitted? Well, the physician that you're working for would either see them if he had admitting privileges, or she, or a hospitalist would see them. And then you would continue to follow them once they got out of the hospital. And we have graduates working in pretty much all of these areas from our NP program. And then I'll let Susan talk about CNS roles.
Ooh, I don't know how to work that little gizmo.
Oh, you don't? Okay.
I don't want to touch that. So the clinical nurse specialist is the least understood of the 4 APRN roles. I feel pretty safe in saying that. We are, and the reason for that is because sometimes you'll see a clinical nurse specialist and you won't be able to distinguish what that person is doing from what a nurse practitioner does. And so you'll think, now I get what they do. Well, that's just one piece of what a CNS does. So we, I I don't have it on this slide, but we work in 3 spheres of influence to improve the health and outcomes of our population. So back to that other slide with the populations. So we work through nurses and nursing to improve nursing practice, to elevate or advance nursing practice. We work to identify gaps in practice and processes that break down. We look at quality, and we try to advance evidence at the bedside, and we call that our nursing sphere. We're working to improve nursing so that the overall goal is to improve our patients' outcomes. So that's a piece of our work that is very different from a nurse practitioner. The other sphere that we operate in is the systems piece, and that is where we look at a unit or a service line or a hospital or a hospital system, and we're doing the same thing where we're looking at gaps, we're looking at where evidence is missing, where we aren't practicing the best evidence, and we try to improve those processes, close those gaps, develop those programs or processes of care. So that's at a much broader level, but that's our system sphere. And then the third sphere is the patient sphere, and that is the sphere where you will see a CNS working much more directly with a patient. And so when they're working just in that sphere, or maybe that's what their job is to work like that, you will see much more overlap and similarity with the NP. So you might see somebody who practices in one or all 3 of those, but that is the diversity of our role. It's also what makes it fun. It's what makes it, what I love about it. But it also makes it confusing, because you can't just see one and say that's what they do. So our nurses are our graduates are predominantly employed in hospitals. As a graduate of this program, you can work from wellness through acute care. So you can work inpatient, outpatient, home health, you can work across, but what you cannot work in is anything other than adult gero. No neonates, no peds, no delivering babies, no psychiatric nurse. So you're limited not by geographic or acuteness of illness, but by your population, if that makes sense. So we do have some working in physician practices, in clinics and offices all over the state. And then, of course, we have some teaching, like me and Dr. Kraft. Specialties, we try very hard to identify the specialty, or we help you identify your specialty, and then we work with you to help you develop that specialty. So if you come in and you say, well, my interest, my specialty is pulmonology, and then you've only worked in one hospital and one unit in a pulmonary unit, then we try to help you develop your knowledge and your expertise in a broader way about pulmonology. So maybe inpatient, outpatient, pulmonary rehab, those sort of things. But if you have a specialty coming in, we just try to help you strengthen that so that when you come out, you're much more of an expert than you were when you came in your specialty within the population. So these are examples of some of the things that you can do. Stroke coordinator, sepsis program coordinator, you can be a diabetes specialist, inpatient, outpatient. We have several that are here on campus in the valve clinic. It's an outpatient clinic, but they also do inpatient care as well. So any number of these things that you see listed here are things that you could do as a DNP graduate, as an adult gero CNS. Questions before I sit back down? Or okay.
As far as the roles for the nurse executive, you can work at a corporate level, you can work at a systems level, and when I say systems level, that's usually over more than one hospital. You can work at the local level, which is usually a chief nursing officer role. You can also work as a chief executive officer. I've seen several within a corporate group where the CNO is the chief executive officer. Well, she wasn't CNO, but she had background CNO. And executives of quality, you can be the VP of quality. You can work in governmental agency, you can work in policy development, you can work in health informatics, public health, home health. You can teach, as you see all of us up here, anybody up here, any of these roles you can teach in. And you can be a consultant to several types of organizations. It's very varied. There's not much that you can't do without an executive nurse leader role, except practice. You don't usually do any bedside practice. had people that have come in management roles. They could have a DNP as a director. But if they're married to practice, that's not something that you're probably going to spend a lot of your time in as executive nurse leadership role. You have to be able to work through others and get a lot of satisfaction from developing others and helping patients in the aggregate, and not necessarily on a one-on-one basis. Although you will get involved with that from time to time, especially if they're upset about something. So it's a great role. I love doing it when I did it. So just think about it.
I think that's the beauty of having some courses individual in your pathway, because you're going to be with people who are very like-minded to you, but then having the DNP and a lot of the core courses as a group, because you do get to sit in the classroom or online chat rooms with people from different backgrounds than yourself. Pam and I and Susan and I, the three of us are representing all the different roles, and we've all practiced a lot, but then our minds are very, very different. In fact, we sat in a meeting this afternoon and Pam was picking out numbers on my sheet that were wrong, and because she's focused on that kind of thing and I'm not. I'm like, let's talk about heart failure or something else. I don't want to look at numbers. I'm terrible at numbers. So anyway, it's a good, rich learning environment to be in a educational program that has nurses with various backgrounds and going different places than you're going. And if you feel like we're driving this home about where do you want to practice and what type of population, I know if you have any access to social media, you'll see all the buzz about FNPs practicing in the inpatient setting. And so we're really trying to make sure that everybody knows exactly what they're applying for, what they want to do, what their goals are going forward. So I apologize if we're a broken record, but we just want everyone to get into the right program that's right for them. So I think Susan on the last time said that yeah, go ahead. Oh, okay. She said, there are many buses in nursing. We just happen to have the bus for the adult Gero CNS, and we have the bus for the FNP and the bus for the executive leader. If you want to be on the pediatric nurse practitioner or the acute care nurse practitioner or the neonatal CNS bus, then you'll have to go to another bus station, because we don't have that bus here. So, yeah, I like analogies. Go ahead. I can repeat it if you can't.
Say if you are unsure about which path you're trying to decide between two, and if the DNP courses are the same for all three courses, is there a point that you can stay in those courses until you get to that point to have to make that decision, or is that something that you a hard stop that you need to know up front before going in?
Okay, it's a great question. She asked, do you have to basically declare a pathway before you start the program? And you do. We ask you to declare your pathway on the application process because you're going to actually interview with the faculty from that pathway. So if it's fine. We all have kids too. You're good. It's okay. You're good. Welcome. So you will need to declare a pathway, but if you're unsure, come set up an appointment with whoever it is, the two of us that you're considering, or all three of us, and let us talk to you a little bit about it and help you sort it out, because we may have some insight after you kind of tell us your background that say, I think you'd be best for this pathway.
And the courses are
I just wanted to add one thing. We are limited by the number of students per faculty in each of our, so that's one, it's good for you. I mean, we're not like some programs where they'll have 100 graduates a year. I mean, it is in your interest that we have limits placed per student faculty ratios, but we can talk to you and really make it clear. I think we've talked enough among ourselves that I can tell if it really sounds like you are really having a passion for executive leadership or nurse practitioner. I mean, we can tell that and steer each other, students, one way or the other, and help you figure that out. We do it all the time. It's easy.
So with that being said, you said you all have a limited number. What is that number?
You answer that one.
Okay. No, you're fine. So we just look at how many applicants we have who are qualified, and then we do set a number. I'll just tell you what we did last year, and then we haven't really decided yet going forward. But last year we admitted 45 family nurse practitioner students. There were, how many CNS? 12 CNS were admitted, and 10 in the, it's currently a master's in administration, but at the administration or executive leader, there were 10. So.
And then is the program, are you able to admit in the spring and fall, or is it just?
No, it's one admission cycle. So the applications are going to open October 15th. They're not open right now, so don't go into CAS and try to work on it because it's not open. October 15th is when it opens. They're due January 15th, 2020. And then you'll be notified of whether you get an interview around the first part of February, and we'll do our interviews the first and second week of February. You'll do your interview with the faculty in the pathway that you've selected, and then you'll be notified of your admission status around the first or second week of March. The programs all start in June, first week of June, regardless of pathway. Question.
Are the BSN DNP courses enmeshed with your other programs, or are they like declared specific for the BSN DNP? You still have your masters and all that?
Good question. Yeah, the question is whether they're enmeshed with the other DNP students, and they are. So we have some students that are that will apply that already have a master's degree, and they just want to do what we call the DNP completion. They just want the DNP portion of it. You'd be in class with those people as well. So,
Would we compete for a spot?
Oh no, those are separate admission. Yeah, because they're already an FNP, or they're already yeah. So no, that's a whole different group of people. So, question.
45 students, was that for each campus?
Oh no, total. Yeah, total. So we admit to Tulsa and Oklahoma City for the FNP program. There was 45 total. So like I think 25 and 20 or something like that. It just depends on how many applicants we have, but that was a total admission. Okay, let me see. Whoa, my knee just like gave out. Yeah, I mean, it didn't really hurt. It just like collapsed. Yeah, it just folded. Okay. I'm in a room of nurses. It really didn't hurt. It just like.
Do we have an orthopedic nurse?
No kidding. Okay. I'm good. I'm okay. No, I'm good. I'm good.
Put the brakes on that thing.
I'm like more embarrassed than hurt. Okay, so keys to success, just making sure that you have a good support system in place and that you've thought about your financial plan. One of the biggest questions we get asked is whether you can work and go to school. And you can, it's just difficult. And so if you're in the full-time program, we would recommend that you don't work or that you work very little. And then if you're going into one of the part-time programs, then you can work a little bit more. And I know everyone has families and life to deal with. So just choosing the 3, 4, or 5-year plan that fits with what you're going to need to work for. And then, of course, there is financial aid available. And we're going to talk a little bit about another opportunity in just a minute on financial part.
And we have a question.
Okay.
But I don't think that's working. 2 questions. First one, can a student go from full-time to part-time or vice versa once the program starts?
Okay, so the question is, can we change from full-time to part-time or part-time to full-time once we get in? And that's a maybe. You can go from, no. You can? Okay. It's going to kind of depend on pathway and numbers, because it's easier for a student to go, especially in the NP program, to go from part-time to full-time. That's an easy switch based upon the way the classes go and just numbers. But it's harder when we have a whole bunch of people going from full-time to part-time, because then we get these humongous classes of part-time. So that I'm just answering for the NP program. So we really, in the NP portion of it, pathway prefer that you stick with what you were admitted to, but like I said, I know things happen. Your spouse may get sick, or you may have a wreck, or something happens. You get pregnant, something like that. So we can work with you, but as a general rule, I'm going to say no on the F&P people.
You can do that in the executive program. It's not an issue. I've had students do it both ways. Of course, we haven't done the BSN DNP, but in the master's program they've done, it's not a problem. So
We have students who have gone from full-time to part-time. We have not had any do part to full-time. I'd have to really look at that. We try very hard to keep people in the tracks and on the paths that they started, but you know, things happen and we understand that. What we try very hard is to not let too much time lapse so that by the time you graduate, you know, you've spent 10 years doing this, because that's just not good for you. And if you're in one of these two tracks and you took pharmacology early on, you have to have had that within 3 years of when you apply to the board for prescriptive authority. So if we don't keep up with that and we don't tell you, that can slip by and you'd have to actually repeat that course. So there's a lot of things to consider. We just don't say, yeah, go ahead and feel like you can just drop out. I mean, go part, go full. Try to make sure that you do these things of strategic plan and look at your work-life balance, look at your support system. The hardest thing for our students is when they come in working full-time, which we do have students working full-time, but when they work Monday through Friday, 8 to 4, 9 to 5, and then they're trying to get in all of these clinical and practicum hours. That's very, very difficult to do when you work 8 to 5.
yeah, I'd emphasize that too. I always tell the students if they work full-time to really, really think about part-time. Some of them are just bent. They're going to do full-time, and then they usually change to part-time. So it's a lot of work, so you really need to take that into consideration.
Okay, so a few frequently asked questions, and then we're going to let you guys open it up to you guys for questions too. And we'll hang around a little afterwards if you have questions, or you can also email any or all of us if you don't want to ask it in a public forum. Is RN experience required? No, it's not. You can apply immediately after you complete your BSN. However, I did have a student in the last group that asked, she wasn't going to complete her BSN until July, but so she won't be able to apply because the classes start June 1 and you have to have your BSN already. Mm-hmm. Yeah, you have to be a licensed RN. So yeah, you have to have your BSN completed and be a licensed RN. The rotations for your clinicals, we have a clinical placement coordinator who does facilitate placing you in your clinical setting for the precepted hours and the NP and the CNS program, because those are difficult to find. And so she helps with that. And then the DNP portion, the preceptor hours on the DNP portion, is usually done more in your workplace or in an existing clinical setting, so you don't have as much difficulty finding that. But the clinical rotations, we do have help with that. We already kind of hit on whether or not you can work full-time, part-time, etc. We talked about that already. Sure.
Christina in Tulsa says, it looks like a lot of courses for CNS and FNP overlap for the programs. Even if two people choose different pathways, will the CNS and FNP students be in classes together?
They'll be in the same DNP courses, and they'll be in the same 3 Ps, physical assessment, pathology, and pharmacology. But so there's probably like 7 or 8 classes that they'll be all together, and you'll also be with executive leadership on a good amount of those too. So can I start another program and transfer to OU? We've had a lot of questions about this lately through email. You can, but we can only accept about 25% of the hours, so it kind of equates to about 12 hours that we can accept from another university. So if you've started at one of the other programs and have 40 or 50 hours into it, I wouldn't transfer if I were you, because you're going to lose a bunch of hours. So if you've only taken 1 or 2 classes and you're interested in transferring, we can talk to you on a one-on-one basis about what you took already and if it would transfer here or not. So, and that would be the same if you want to transfer, but we don't want you to. We've already talked about ICU, inpatient, outpatient, ad nauseum. Yeah, I think we have. I think then that it just kind of comes down to your personality, what you're wanting to do. Do you like the fast-paced inpatient life and want to do that at an advanced practice role? Do you like people who walk in and walk out of an office stable? There's no emergency. That's me. Do you like to be in charge of a meeting full of 20 executives and you're up there leading it? Then great, we have the fit for you. So all three of those things. We do have some scholarships available, so those can be found on our website. And one note about our website, right now it's not current. We're going to have it up probably within the next few days, but I don't want you to go and look at the website because it's going to differ from what I've said or what we've all said tonight. So the website is reflecting old information. All right, so we're going to open it up for you guys to ask questions, and then we'll get back to. Yeah. Yeah. Are there questions about any of the things we talked about?
Usually there's a lot of questions, so there's no question that is dumb or uninformed. Just throw it on out there because you probably have it and 3 other people have the same question.
You covered it all.
Really? Okay. Well, that's a first. Yes. Go right ahead.
Are other programs making the switch to the DNP as well, and will that make us more marketable graduating from a DNP program even before 2025 or after 2025 versus people who have maybe just graduated with a master's? Does that make sense what I'm asking? Mm-hmm. And is it more money if you have a DNP?
Okay, it's okay. Oh, he hit his head. Poor baby. Our volume was turned off. I just started thinking if I turn it on, then we can talk.
Also, we might can hear you now if you raise your hand. Raise your hand and see if we can hear you.
Okay. So the question, it's a really good one, is until 2025, when up until that time, a DNP is not required for advanced practice nurses. You can still practice with a master's degree. So going beyond that, anybody that graduates with their master's degree before that time is going to be grandfathered in. So you will not have to have a DNP degree. You'll still be able to practice in 2028 if you have a master's degree because you'll be grandfathered in to practice. And you'll already be licensed and seeing patients. So it's the same as it was a few years ago, maybe 20-some years ago. Nurse practitioners or CNS only had to have a certificate program. It was not a master's degree. And so you'll see an older nurse practitioner, CNSs that are out there practicing today with just a certificate degree. Not CNS, just NPs. Okay, all the intricacies are so hard to keep track of. I have a hard time with just mine. So you'll see NPs out there that are older and practicing, and they did not get a master's degree, but they were also grandfathered in when the master's degree came about. So this happened before, and now we're moving it up another notch. It was certificate, then it went to master's. Now we're moving it to the doctoral level, so you would be fine. Are you going to get paid more with your DNP versus a master's degree? Kind of depends on where you go and what your position is. But right now, in the current setting, no, probably not.
But as an executive nurse leader, you're going to be the highest paid in the organization.
Exactly. You're going to move yourself up in career advancement because of your DNP, which then would bring you more money. But if you had 2 people sitting in the same position, and one had a DNP and one had a master's, it's hard to say as to whether or not you would be making more, but your career advancement brings you more money.
Do you think it makes you more marketable, like more hireable? Mm-hmm.
Yes, for sure. The DNP, you're going to start seeing ads for employment that say DNP preferred because it's so many people out there that are getting them. And I've already seen those at some of the major hospital systems in the state. It says master's level accepted, but DNP preferred. So.
And as the DNP gets more integrated into the healthcare systems and they see the impact that you can make, and we've seen it across the street, that we have several DNPs have graduated from this program that have gone across the street, and they have seen the impact of what they can do. I think you're going to, You know, I would say as an executive, I wish I had only done it sooner. And I don't think it's an if, it's when. You know, you need to do it now when you're young and keep going. So,
Yeah, it's a hard job market out there right now. In some,
That was my other question. I'm just gonna ask one question.
yeah, that's fine.
Our graduates from your program, what is the ratio of people getting a job?
Well,
Or maybe even not even just your program, but even across the state, if you know, or just from your program, like your graduates, are they getting jobs fast, or are they having to still work as a RN trying to find?
I can speak for mine, and then I'll let Susan speak for hers. I know all of the 2018 19 graduates in the FNP program, but one are employed in an advanced practice role, and the one that's not, it was by choice. So, and we also have the same 100% pass rate for many, many years on first attempt. So you can talk about CNS though.
For the CNSs, as far as I know, all but one, but she moved out of state too. She moved to Texas, so the jobs are out there. Yeah.
Oh, there was a texted question. So the texted question says, does the research class in the OU ABSN program meet the research class requirement for admission? Yes, it does. Yes, so you're good. Other questions? Yeah.
Do you foresee adding any of the other APRN programs in the future?
That would be a Dean Melissa Kraft question.
Tulsa, if you push your button, I think maybe we could hear you now. Just somebody try to push their button and talk. No, it still didn't work. Okay. All right. I tried one more thing. I thought, oh,
It's
that'll
all
work.
right.
Oh, well.
I think that's a great time to introduce Dr. Melissa Kraft, who's our Associate Dean, and let her kind of talk about that, but she also has some financial information that she was going to talk about as well. So I'll let you.
Let me field that question.
Yeah.
Is there any particular APRN role that you are interested in?
No, I'm just asking.
Okay. Always doing a market assessment there. You know, we have been contacted by several groups over the years. CRNA is certainly something that many people are interested in. We, you know, are always open to looking at the market assessment. It is very, very costly to do a CRNA program, but that's not the main factor that we look at. So we look at faculty, we look at needs of the state, we look at the sustainability of interest in a program. So the answer to your question is, I will never say never. At this point in time, I can tell you that we don't have anything going to the regions in any time soon for that. The other thing that we've looked a lot at is a psych NP program. We feel like it is definitely needed in the state of Oklahoma. Certainly we're not alone in that. I think another, you know, again, looking at the number of people that would be interested in the program, the number of jobs that are available for people, the support for that particular role in Oklahoma is something that we look at. And so I would say of all of the additional APRN roles, that's probably one that we're closest to trying to get something going with that.
When they came out, there was one that they said that people should start moving that direction.
Oh,
Have be more employable.
right. Definitely something that's needed for sure. But we're always, you know, I am always interested to hear what you feel like is needs. And we do look at not only the national data, but the state data on what would be supported. Because just to your question, we don't want to go with what seems to be everybody's doing and get in a position where our graduates are not able to find positions when they get out. We want to fill a niche that also works for you as well. So then I'm going to segue to money because I know that the night is getting on. But obviously this costs money. And so making a decision to do an advanced degree of any kind, whether it's a research degree, whether it's executive leadership or APRN, it's not free. And so it's a big decision. And that's why we do these kinds of sessions. So how anybody here think that they would be interested in teaching when you got finished? Show of hands. Okay, so a few of you. So for everybody else that says, ooh, I don't think I'll ever be a teacher, you guys are the ones that are going to be here, because that's what I said. How about either one of y'all? Yeah, I said I would never, when I got my master's degree, and I'm a clinical nurse specialist, I'm an oncology cleanse bag. When I got my master's, I told my husband, if I ever start talking about another degree, just shoot me, because it's clear that I have been bitten by a rabid dog. And so 13 years after I got my master's, when I started on my PhD, he's like, do I shoot you now? Like, no, that wouldn't be good. Doesn't look good. So never say never. I said I would never go into research, and I'm a researcher. I said I would never go into academia, and I'm in academia. I'm associate dean. So you just never know. But if you are thinking, for everybody that thinks that they won't be an educator, what I would encourage you to do financial-wise is start looking at the patchwork that you can do to get the money to go to school. Look at your specialty organizations. If you're not a member of an organization, join one, because many of them have scholarships for education. It may not seem like a lot, but anything helps. And that's what I did with my PhD. I just, this little bit from this organization, this little bit from that organization, this little bit over here, Sigma Theta Tau, if you're a member of Sigma Theta Tau, both at a national level and at your local chapter Beta Delta, sometimes we don't give the money that we have set aside and budgeted for scholarships because nobody applies. So really start tapping into those resources. Tap into your workplace, because many workplaces will support you in whether it's tuition reimbursement. Some of them, they want you to stay with them for a while afterwards, but that's not always such a bad thing either. So check into workplaces. The other thing I wanted to share with you is that if you think that you would be interested in teaching, or if you're currently teaching, we recently received about $60,000 from HRSA, from the federal government, for something called the Nurse Faculty Loan Program. And what that is it is a loan that you take out. You have to be full-time or part-time in either our Masters of Education program or our DNP program or our PhD program. And you have to be planning on going full-time into teaching when you're finished at an accredited school of nursing. Now, there are a lot of accredited schools of nursing, and it doesn't just have to be Oklahoma. This is a federal grant. The reason for it, federal monies, the reason for is that we all know, we're not getting any younger, and we need faculty, we need a pipeline of faculty. And so this money is to encourage people to go into teaching. Again, some of you might think, I don't ever want to go into teaching because I'm a clinician. Every single one of us can say we're a clinician. Our patient population, it may be an aggregate, it may be an individual, we're all clinicians. And we're all in academia. We all still, one way or another, get our hands on patients, whether that's research, whether that's practice. And so you can be a clinician and still teach and feel very fulfilled. But if it is something that you're thinking about, then seriously consider the Nurse Faculty Loan Program. You can borrow up to $35,500 per year for each of 5 years, maximum of 5 years. When you're finished, and you can borrow that all along, when you're finished, within 9 months, you have to get a job full-time in an accredited school of nursing. And then after the first full year of being in that job, you make application, you show evidence that you're in that job, and 20% of the total loan is forgiven. Okay. The second year that you're in that position, another 20%, up to the fourth year when 25% is forgiven. So at the end of those 4 years, you have 15% left of the money that you borrowed to go to school that you have to repay at about a 2% interest. The reason why I'm talking to you is because it's a great deal, but it's not such a great deal if you do the loans and you don't get the job in teaching, because then after that 9 months, it goes to the market rate that you would have to repay the note at, could be 16, 17, 18%, and it all starts becoming due at that point. There's still a regular, long schedule of repayment, but it's not going to be forgiven. So if you are interested in it, because it has those strings attached and because it is very specific, what I'm asking is that you contact me directly. And I'm the project director for this, and you'll get to be my buddy, because we'll make sure that this is something kind of like the pathway. Make sure that this is the right thing for you to do, and that at the end of it, you are going to be in a situation where you've been able to fund your education and only pay 15% of all that you borrowed from that, okay? Any questions on the nurse faculty loan program? Okay. Well, I appreciate you all being here. Are there any other questions on anything?
But I know the CNS is specific for adult gero, I'm in neonatal slash peds. So, I mean, my current role is a nurse navigator for pregnant moms. You have to prepare for the NICU for these moms. Their babies don't make it.
So that's a great question, and I think I have a colleague who is a nurse practitioner, and she is board certified in palliative care. She doesn't work in a hospital. She has worked with hospices. She has worked in an outpatient setting. So it really would depend on, again, kind of like we talked about, the fact that it's palliative care in and of itself doesn't necessarily push one way or the other. What really, in your story, just like Dr. Dresser said, there are things that you said that make me pick up, which way it might be best for you. So if the pediatric population is what you're really interested in, then it's definitely not our CNS program. A CNS program would be a great option. It's not ours. If you said NICU, so obviously that's not going to be a home setting. So if you're thinking, I really would be interested in palliative care for children in an acute care setting, at least with an acute care setting option, then you're either going to need to go to a CNS program that's peds, or an acute care NP program that includes the pediatric population. But that's a great question and a great example of some of these buses are real specific. Yeah, they're teeny tiny Mercedes buses. Right. And it's so important, it's like disappointing because, like Dr. Dresser said, we just want it to fit here, and this one's the right one, it's the right location, all this kind of stuff. But if it doesn't get you to, when you get off that bus, doing what you're passionate about, then that's not the right fit, because it won't. Neither one of our buses are going to get you to be in palliative care for kids in a hospital. Somewhere along the way, you'd have to give something on there. Okay? Makes sense? Okay, I've got another, sorry, I'm hogging your microphone here. So it says, what would give someone an edge in their application to the program? What are we looking for?
We hold application workshops in Oklahoma City and Tulsa, and those will be put out as the dates for those. But I will just say a couple of things, especially in your essay, if you can distinguish yourself, either talk about your experience, talk about any volunteer experience that you have. Perhaps you've done some medical mission work, or maybe you were in the Peace Corps, or you're from rural Oklahoma. Try to write about things that make you different. What we don't want to read is, I want to become an advanced practice nurse because I want to help people. We all want to help people. And we see that all the time. So we really are asking you to try to make yourself stand out from the next 130 some applicants that there might be, because there are a lot of good qualified applicants out there. And the ones that are unique and talk about experiences that make them unique are the ones that we remember. I'll never forget the one, and I say this every year, this guy from Tulsa applied to the adult Gero program. That's when we still had an adult Gero nurse practitioner program. A few years ago we had that. And he was a concert pianist from the time he was 4 all the way up until his mid-20s, and got up every day and practiced his piano from 4 a.m. to 7 a.m. and talked about his work ethic and how he was going to balance working full-time as an RN, being a concert pianist, and going to the NP program. And he did it. And I'll never forget that application because he talked about that thing that made him so unique. Another example is if you speak another language, really highlight that for us. Or if you're from, because we do have, populations that need advanced practice providers. So if you're lucky enough to speak another language, let us know and talk about that. Another one talked about how she had gone to all 50 states before she turned 18, and just talked about all the different cultures that she saw across our one country. And so it was really nice to see that she had a grip on culture, because obviously nursing, there's a lot to do with culture. So I'm just kind of giving you a few examples of how you can set yourself apart from somebody that's sitting next to you. The other thing that I would really talk to you about is the references. Really choose who you're going to ask to write your reference letters, because every time we get some letters that aren't actually that great. And so just make for certain that whoever you ask to write your letter is going to definitely write you a glowing, not just mediocre, but glowing letter, because it's really unfortunate when someone thinks that they're going to get a great reference from this person and then they don't, and they're blind, so you don't know what it says, but we do. And so just be really, really certain that you know the person very, very well and that they're going to say nice things about you. They don't all have to be from doctors. In fact, none of them have to be from a doctor. That's a misconception that we also get, and they sometimes tend to be pretty just cut and dry form letter, that I have known so-and-so in the ICU for 20 years. She's a great nurse. She'd be a great nurse practitioner. The end. So, and I'm not bashing doctors, but that's kind of what they're like. They dictate it in between 22 patients, and it's like, so make sure that they're going to be able to talk about what makes you unique and what makes you a good applicant. So just choose your references wisely. If you went to OU, maybe think about asking one of your OU professors, or if you know someone. So just really think through who's going to write those letters for you and make sure that they're going to be good. Do y'all want to add anything on? No? Okay. Did that answer whoever asked that? Yeah? Any other questions? Yeah. Uh-huh. I don't know the answer to that. Do we?
The answer is no.
No, okay.
Not for this.
Okay. She asked if we gave preference to OU graduates for either if they already had their bachelor's or master's from OU, and it's no, we don't. So, but we welcome you back with open arms. And we're glad that you already graduated with us. Other questions? Oh, he's singing now. Okay, well, what we'll do is we'll hang out for a little while in case you have a really specific question, or perhaps you don't want to ask in front of everybody. And then in our distance sites, if you'll see our emails that are listed there. And if you have a question for Dr. Kraft, her email is in the same format as ours. It's Melissa-Kraft, Craft, and then the same ending. So if you have a question for her about that nurse faculty loan program. So, but we'll hang out for a little while here in Oklahoma City. So thank you again for coming. We appreciate it, and email us with any questions that you have, okay? Thank you.